We lost Danny because, he was late paying his Medicaid plan, so they cut him off of his medicine, risperidone, which has a known suicidal risk. He subsequently superglued his seatbelt shut and drove his truck into the Mohawk River after giving us a suicide note.
This is what Chris Hedge talks about with late-stage capitalism and the death of an empire. If you're continually killing people by denying them basic human rights. Hey, it's Jordan. I am in Flint, Michigan, East Palestine, Ohio, Tumwa, Iowa. Please support the only independent outlet on the ground covering what the corporate media covers up. Hey, it's Jordan with Status Coup. Yesterday, the CEO of UnitedHealthcare, one of the greediest, most soulless healthcare companies in the United Corporations of America, was fatally gunned down by all appearances by gunmen with a motive due to the healthcare company's denial of treatment. We don't know the full details yet, and the gunman is still on the loose, but the CEO was fatally killed, and police and new information found seem pretty clear that it was retribution was the motive. This is from the New York Times. The police are now investigating apparent messages found on bullet casings at the scene of the shooting. According to two law enforcement officials, ballistics testing is continuing, the official said, but the casings appear to have been inscribed with words including delay and deny, potentially references to ways that health insurance companies seek to avoid paying patients' claims. I don't think it's potentially very clear. That's what that means. If that's the inscriptions that were on those bullet casings. Here's a little bit more. More recently, UnitedHealthcare and other insurers have been the subject of scrutiny over denial rates in their private Medicare Advantage plans. Last fall, the majority staff of a Senate panel released a scathing report of insurers' refusal to pay for care for older people who have suffered falls or strokes. UnitedHealthcare in particular was cited for a surge in denials for what is called post-acute care. Under United's system of prior authorization, the report found the denial rate for post-acute care increased to 22.7% in 2022 from 10.9% in 2020. Yeah, great healthcare system. Why do we want to get rid of our private health insurance? Remember that? The propaganda we were all fed during the 2016-2020 Democratic primary by MSNBC, CNN. But Bernie wants to take away your private health care. Well, private health care, Medicare Advantage, they're trying to privatize Medicare. Trump did it and Biden continued it. And proof's in the pudding. I'm not condoning outright murder, but this is what Chris Hedge talks about with late-stage capitalism and the death of an empire. If you're continually killing people by denying them basic human rights like UnitedHealthcare, which, oh, by the way, has the highest denial rate for insurance claims of the major health insurance companies. Claim rates by insurance company. UnitedHealthcare, 32% denial rate. If you, through your greed that the United States government sponsors by taking legal bribes from UnitedHealthcare and all the rest, if you are killing people or allowing them to prematurely die, eventually there's going to be violence towards you. And we're not just talking about the health insurance industry. You could go to Wall Street, the fossil fuel industry, Silicon Valley, big real estate, doesn't matter. There's a lot of preventable deaths in this country due to capitalism and greed. I want to show you, some people might not like people responding this way to, somebody just outright murdered, but these were the responses. If you need to renew your hope for humanity, read the TikTok comments. One person says, will his family still be billed? Somebody asked. Sending prior authorization, denied claims, collections, and prayers to his family. Did the ER wait to render care until they confirmed coverage? Was his trip to the ER really emergency? According to his own company, my husband's heart attack wasn't an actual emergency, and we were out $3,000. So that's just some of the response to the CEO of UnitedHealthcare, being murdered. Again, the gunman is still on the loose. I just literally typed in because I was trying to find a story that I covered a couple years ago of a woman denied health insurance literally the day of her surgery. I believe it was a cancer treatment. I had trouble finding that, but just typing that into Twitter, I mean, you find just stunningly evil, immoral examples of what UnitedHealthcare and other health companies are doing to people. And we're sitting here talking about democracy and fascism. How is this democracy? UnitedHealthcare denied my surgery 2 days before it was scheduled. I was in the hospital finance office in tears when I was supposed to be at the hospital doing pre-op stuff. Another one, remembering when my friend needed a preventative mastectomy because the breast cancer was predicted to spread, but UnitedHealthcare denied the coverage. So she had to wait for the cancer to spread and undergo more therapy to get the mastectomy anyway. Fuck you. Another one, I know a woman whose insurance denied treatment she needed for breast cancer. They wouldn't pay for it unless she got a mammogram. She couldn't get a mammogram because her breasts were removed the first time she had cancer, which the insurance company knew as they paid for it. Fun fact, this company denied half of my cancer treatments, including 3 of 4 necessary chemo drugs, the mastectomy to remove the cancer, and all of the radiation treatment, referring to UnitedHealthcare. I mean, it's just stunning. And this is literally normalized in America by both parties. This is normalized and has nonstop propaganda swirling around it by MSNBC and CNN and the New York Times. No other country, a civilized country with similar wealth, and most of them are far less wealthy than us, has systems like this. It's unheard of in most other wealthy civilized countries. We have a completely unnecessary, for-profit, greedy, evil middleman, basically. You want to talk about national security threats? Russia? China? How about capitalism? How about the for-profit pharmaceutical industry? And even before this CEO was gunned down. And again, I'm not here telling you go gun down CEOs. I do believe in nonviolence, but it seems that the motive was retribution. And it seems like, based on deny being in the bullet casings, you could understand whatever this shooter's motive, you could understand it based on all of the awful instances. I mean, look at this. This was just recent, came out. Anthem Blue Cross Blue Shield won't pay for the complete duration of anesthesia for patients' surgical procedures. What? Somebody put it best. Sorry, ma'am, while you were unconscious in surgery, circumstances out of your control meant your surgery went past the cutoff time we made up. So we'll take the opportunity to not pay for your health care now. P.S. We will still happily accept your premiums and raise them year over year. I mean, what kind of hellscape are we living in? What kind of hellscape are we living in? And by the way, we are not just sitting here in a studio talking about this. Status Coup has been covering this economic Hunger Games, this United Corporations of America on the ground for years. We covered Medicare for All protests. We covered protests against insurance, specific insurance companies. If you remember, I believe it was on, I'm trying to remember, a holiday. I went out in New York City and I covered a protest in front of Fidelis Care, who literally denied treatment to a young man, Danny Desnoyers, I think I'm pronouncing his name right, because he had a $20 overdue bill. A $20 overdue bill. They denied him. They cut off his medication that he needed for his mental health. He had a severe mental health issue. And because they cut him off over $20, he committed suicide, drove his car into a river. Here's a reminder. Here's some of that coverage of the protest. And here is his father, Scott Denoyers, who has been fighting the good fight for years for universal health care. Here is him in front of Fidelis on behalf of his murdered, yes, murdered son.
The reason we are here today, we have narratives that are given to us by our local lawmakers, our politicians, and the mass media. These narratives are that companies like Fidelis Care are here to get us health care. Our Republicans, our Democrats are all back in saying the same things. Republicans will tell us the Democrats are raising the cost of our health care. Then the Democrats will say the Republicans are trying to take away your health care. Which one is telling us the truth? Neither. Neither one of them is trying to get us health care. They're fighting to get insurance contracts for us that deny health care for their profits. That is not giving us health care. Don't tell me that health care is a human right, but here's your contract that will deny that health care for our money.
These kind of people have been out there for years as politicians from the Democratic Party, politicians from the Republican Party, gaslight them and stonewall and give propaganda so that they could keep taking money from these deadly, evil companies. Here's a little bit more from my interview so you could really get a taste for how evil this democracy really is. So we're out here with Scott Denoyer, and I was just telling them a little bit about the background with your son, if they didn't know. Today is the 4-year anniversary?
Yep. Yeah, it's a 4-year anniversary. It was April 9th of 2019 that we lost Danny because, you know, he was late paying his Medicaid plan, so they cut him off of his medicine, risperidone, which has a known suicidal risk. I mean, he subsequently superglued his seatbelt shut and drove his truck into the Mohawk River after giving us a suicide note. Fidelis Care, founded by Father Patrick Frawley in 2018, originally as a nonprofit organization, but he still received a very hefty salary. I might add that Father Frawley...
Just want to add, this father, since it's Easter, 2018, $5.3 million. $5.3 million from Fidelis Care. This is a reverend who made that much money just a few years ago. I don't know how much now, but that was just a few years ago.
Well, he was promoted to VP of Centene and given the title Social Responsibilities. I believe his titles or his pay is only $4.9 million a year now, but I could be wrong. And his tenure is pending as they had a shakeup, as Centene also lost Michael Neerdoff in 2019. Couple months before our last action, or 20. What we lost, Neerdoff was lost last year. But anyway, Father Frawley now gets paid $4.9 million a year to deny Medicaid patients the health care that they need to live. The poorest among us, the health care that they need to live. Like I said in my speech, I'm not very religious, so I'm not going to be a hypocrite and pretend that I am. Father Frawley is. He wears that collar for every photo shoot that he has, and yet his God's teachings was to heal the sick, to help the poor, the impoverished. He's not doing that. He's enriching himself off of their pain, their suffering, by making sure Danny didn't get his medicine. That's $250 that goes to his company. He got pennies off of Danny's life, not even probably a penny. So what we're saying is, on Easter Sunday, if you truly are a man of God, you need to step down from your legalized manslaughter for profit and support us fighting for the New York Health Act, fighting for mass care for, whole Washington. Any single-payer universal health care bill that removes the insurance mafia from our health care system, that demands we pay them if we get sick, if our child gets sick. How should we pay them profits to make sure that somebody else profits from their medical condition? It ain't right, and we need to change the system. And that's what we're doing. We're making sure that we remove insurance companies' profit motive from our healthcare system so that everybody has the healthcare they need when they need it, regardless of their ability to pay for it.
Remove the insurance mafia. And again, neither I'm sure Scott, are sitting here advocating for you to, go get your guns, surveil CEOs and gun them down. Of course, two wrongs do not make a right, and we are not advocating for violence. But at what point do people break? At what point, and I don't know the gunman story, and as of this recording, he is still on the loose. A photo has been released. But I don't know the motive. I don't know their story. But based on the evidence, he was denied treatment, or someone close to him that he loved was denied treatment, and it severely, severely harmed his life. He's not alone. And it's not just, by the way, people being denied. It's the corporatization, the capitalization of our hospital systems. And by the way, we're able to cover this because you, the people, are funding it. We'd like to cover more of this. Support us. Do you see many other outlets out there on the ground on Easter Sunday covering these local protests for government healthcare? I do not. Support us. StatusCoup.com/join. $5 a month. You can become a member to support this important reporting. But we've covered hospital strikes where we're hearing absolutely insane stories of, one nurse covering 8, 9 patients on a shift when they're supposed to be covering 3, which kills people because nurses are only humans and they can't care adequately for 8 to 9 patients at a time. This one, I believe, is from last year. New Jersey hospital workers, 1,700 workers were on strike. I mean, the stories were just incredible. I'll play you a little bit of this. This was at Robert Wood Johnson University. Again, corporations have bought our hospital systems. So it's, again, insurance systems and corporations deciding what gets covered, deciding what level of care you get, because they want to staff as little as possible. They want to have faulty equipment or inadequate equipment. This is who's deciding whether your mother or father gets the care they need, whether your children get the care they need in the wealthiest country on earth. Yet CNN and them, you're not really seeing that in the coverage. Again, no one's condoning just gunning down CEOs, but I don't really see in any of the mainstream media coverage the problem with the capitalist for-profit healthcare system. Take a look. This was me covering a major, major strike at a New Jersey hospital. Robert Wood Johnson University Hospital in New Brunswick, New Jersey. Really, really a lot of people out here. Probably, I would say, a couple hundred. One full side of the street is packed. As far as my eye can see, you have this across the street is packed. This side of the street is packed. I'd say there's a few hundred people out here. If you look over there, you see a big rat, where we've seen this at a lot of picket lines that we've covered. Talking about the scab workers. Robert Wood Johnson has brought in a lot of travel nurses that get paid insane amounts to basically fill in for the striking workers. This is one of the biggest hospitals in all of New Jersey, and but they're still understaffed chronically. So it says burnout caused the turnout, solidarity, fair contract now.
I'll fight this fight until the end, to the max. I have endless energy for this fight because it's important.
Talk to me about the staffing we've seen before the pandemic, definitely during the pandemic. You've had nurses, one nurse to like 7, 8 patients when it's supposed to be, 3 or 4. How bad has the staffing to patient ratio been?
So we deal with something called acuity, which means how sick the patients are, and they're never taking that into account. Before the pandemic, things were getting bad, and after the pandemic, it hasn't gone better. They asked us to step it up, and we did, and now they think that that's okay, and they are not backing down, but neither are we.
And talk to me just about the mental toll, burnout, nurses, mentally. We've seen an exodus of nurses quitting the profession all over the country. Can you talk about your colleagues and the mental, physical toll it's taken?
Nurses have a huge responsibility. We are licensed by the state of New Jersey to not only legally responsible to take care of people, but morally and ethically. And part of our job is advocacy. So we have been letting them know that this is not okay, this is not okay. So to us, this is the ultimate act of advocacy.
That was one of the biggest strikes I covered, period, in any auto, healthcare, climate, you name it. And they did reach a deal, but this is going on in hospitals all over the country where corporations, even church systems. Scott was talking about a reverend who's the CEO of Fidelis, which I think became Centene Healthcare, a reverend making $5 million a year so that they could deny people health care. And their profits, their salaries, their bonuses, a reverend goes up depending on how little insurance and coverage the healthcare company provides. It's the same exact thing in these hospitals, which some of them are church-based hospital systems. But we want to sit here and we want to election after election talk about democracy and fascism. You could call this whatever you want, but this is not a civilized, humanistic society. There's no reason for any of this. There's no reason for health insurance companies. There's no reason for co-insurance, co-deductibles, out-of-pocket limits. It's insane. I mean, knock on wood, I've never had any life or death medical issues, but I've had 2 back surgeries. I was covered for both. Yet I got bills, I believe it was almost $6,000. I had to go on a payment plan. I still haven't paid it off completely. $6,000 and I'm covered. How does that work? I'm sure you leave it in the comments have had horror stories. Mine was my back. It's not life or death, but I mean, so many people, life or death, horror stories. And this also takes away from the economy. All these politicians, we want growth. We want growth. Trump, make America great again. Well, how much money are we pissing away on unnecessary healthcare costs that we could be putting back in the economy, into a variety of different ways that are actually productive? I mean, it's absolutely insane. Absolutely insane. And I would argue one of the reasons Harris lost was because her president, Biden, just completely abandoned, besides minimum wage, he ran on a public option. Doesn't go far enough in my view, but it's certainly better than the for-profit economic hellscape system we have now. The lever. Where did the public option go? Democrats have completely forgotten about a public health insurance option, choosing instead to deliver expensive subsidies to their industry donors. I mean, it's absolutely absurd. And I hate to say it, I don't really think this is going to be the last case of this, whether it be in the healthcare industry, the oil industry, and other industries where people are senselessly dying, not to mention our planet. Because in a democracy, if you tell people there are mechanisms, you have ways of fighting back that are peaceful, protesting, voting, running yourself, but nothing changes. Actually, it gets worse for you. At a certain point, when people feel they have no other option, when people feel, well, it's all rigged and, they're killing us through legal means, so maybe we need to fight back violently, whether they're mentally stable or not. So again, it's not to condone gunning down CEOs, but we can see more of this happen if the system fundamentally does not change. And that goes for Democrats, Republicans, or whatever. They're both in on this. There is no reason to have a widespread private health insurance industry. We have more than enough money to provide citizens government health care. There could be private options for elective surgery and things you want. There could even be private doctors. If wealthier people want to go and you want to pay in cash, have at it. Or make your own deals, have at it. but we have the money for this. It would be far cheaper for the government to pay for healthcare for its citizens. And it's cheaper, by the way, in terms of administrative costs than oh my God, the amount of money we're spending around the world, military bases, bombing half the world, endless wars. We'll follow up as we get more details on this, but needless to say, I don't think this will be the last kind of story like this we'll be covering.